Hello and welcome to Healthy Living. Coming up, we're going to be talking about fibromyalgia. You may never have heard of it, but over 6 million people in the United States have been diagnosed with it. So you really need to sit and listen to it in case someone you know or you may have some of these symptoms, and you may be able to get some help and figure out what's going on in your life. Stay with us. Hello and welcome to Healthy Living. I'm your host, Tammy Thompson. Have you ever heard of fibromyalgia? When I first started researching this show, I could barely pronounce it, much less know anything about it. But it affects over 6 million people in the United States, and we're going to talk about that on this edition. And I have with me Dr. Richardson, a local physician who deals in rehabilitation and pain management, who's going to tell us about it and how we can live with it. So welcome, Dr. Richardson.
Thank you, Tammy.
So, of course, the first thing is, what is fibromyalgia?
Well, fibromyalgia is actually a syndrome, meaning that it is a constellation of symptoms. And when I say it's characterized by its symptoms, it's because we don't know exactly what causes fibromyalgia. The true cause is currently unknown and is being researched as we speak. Fibromyalgia, it helps to have a little history about fibromyalgia. And if we go back into the 1970s and 80s, many of the rheumatologists across the country were starting to notice a subset of patients, mostly women, between the ages of 20 and 60, who were presenting with complaints of mostly widespread pain and fatigue. Now, in the course of just normal treatment, which included extensive testing, what they noticed is that all of the tests were pretty much normal. In other words, these were not women who had lupus or rheumatoid arthritis or any of the collagen vascular diseases or connective tissue diseases, but instead had persistent pain and ache and fatigue. And as a result, the American College of Rheumatology came together in 1990 and established criteria for the diagnosis of fibromyalgia, which includes 11 of 18 defined tender points, widespread pain, meaning it has to be both above and below the belt line and on the right and left side of the body, and essentially all 4 quadrants of the body. And the pain has to be present for at least 3 months. And the reason they did this is because as different doctors were noticing these symptoms, they were calling it by many different names. You may have heard of fibrositis, chronic fatigue syndrome.
I've heard of that one.
Some of the more common names that it gets confused with. Lupus. Okay. Multiple chemical sensitivity syndrome. I mean, the names are getting longer and longer, and we're actually getting more and more confusing. And so they came together to give us a list of diagnostic criteria so that research could be done.
Okay, so they don't really know what causes it, and before we came on, I told you that I've had similar situations. I have a bladder disease, which nobody knew what it was, and they told me that there's nothing wrong with you. All your tests are coming up normal, and there's nothing wrong with you. And so that makes somebody feel like they're crazy.
Absolutely.
And just putting a name to it helps you at least move past that point and be able to deal with it. You mentioned some of those things. I know you have a couple of graphics of what it could be and what it is not, fibromyalgia. Can you talk about that?
Sure. What it's not, let's start with that one, is it's not a musculoskeletal problem.
Okay.
It's not a progressive degenerative disease. This is not like multiple sclerosis.
Okay.
It is not homogeneous. And when I say that,
mean?
I mean not every patient is the same. Often, patients look very different except for the primary criteria of widespread pain, tender points, and pain greater than 3 months. It's not an autoimmune disease such as lupus, and it's not, and this is the one that needs to be stressed, it's not a mental illness.
Thank
this
you
is
for
not
saying that.
depression, although it is very commonly found with depression because of the chronic pain. But this is not all in the patient's head. Unfortunately, we as doctors like tests that we can run and signs that we can see on our physical exam using our hands and our tools. And when we fail to see these things, occasionally we have to consider that a disorder is in a person's mind. And in some cases that can be true. There are some documented psychological conditions. Fibromyalgia is not one of them.
Okay, and the last one that you had on there, it's not curable.
It's not curable, and it's not an infectious process. In other words, if you have fibromyalgia, you can't spread it to your friend.
Okay, but you talked about it not being a mental illness and it's not in your head. In my case, sometimes when you hurt all the time, though, it brings on that depression that you talked about. And so can it affect your mind that way? You know, because you just get so bogged down with your pain and your symptoms.
We have to remember that you can't draw a line between your neck and separate your head from your body.
Right.
The mind and the body are intimately connected. What affects one does affect the other. And when a patient has chronic pain for any reason, whether it's fibromyalgia related to back problems, neck conditions, any kind of chronic pain does predispose a person to develop depression with or without anxiety.
And that's okay.
And that's okay. That needs to be treated separately.
Okay, so it's not a bad thing if that happens to you.
No, it's not.
Okay.
Well,
it's common, maybe.
It's an unfortunate thing because a lot of times when we see depression with chronic pain, it's because the pain has not been addressed soon enough. But it is a treatable condition, and it's not an unexpected condition, and it's certainly no fault of the patient's.
Okay. We talked about what it's not. What could it be?
Well, and this is a very interesting
Right.
topic because I see a lot of patients who say, I have fibromyalgia. And I ask, well, have you been worked up for other problems? And usually the answer is not really. We've had no laboratory studies, no diagnostics done to rule out other common conditions, and the list is very long. This is about half of the list. Myofascial pain syndrome is the number one thing I see confused with fibromyalgia. Now,
and what is that?
Now, myofascial pain syndrome is a muscle disorder, and it is not characterized by widespread pain. It is focal pain. This is the kind of pain you get from repetitive motion. This is the kind, like carpal tunnel, can give you muscular type pain that is myofascial, actually up in the muscles of the forearm. Okay. Another common cause of myofascial pain is whiplash.
Okay.
Because of the muscular problems that you get after a car accident. Myofascial pain is diagnosed by identifying trigger points within the muscle, and they are very different than the tender points we see with fibromyalgia. But there are other things you can have that actually cause widespread pain and ache and fatigue that have nothing to do with fibromyalgia, and that's
like the Lyme disease?
Correct.
Okay, and just go on down the list and just kind of talk about some of the others if you don't mind.
We've had several patients that we've caught on laboratory studies with hypothyroidism. Vitamin deficiency such as B12 and folate deficiency can give you a presentation of numb hands and feet.
Really?
And the reason that is so important to catch is that's reversible. Those conditions can actually lead to neuropathy in the hands and feet if they're not treated. I've seen some people with iron deficiency anemia who have extreme fatigue.
Right.
Hepatitis. Some of the most common causes hepatitis B. Anybody who's had a blood transfusion is at risk for hepatitis B. It can give you severe fatigue, especially when liver enzymes are elevated, when the liver is affected. Chronic Epstein-Barr infection, that's mono. I have a lot of patients who come in who've been fatigued for 6 months or 9 months, and they remember it starting with a viral illness, and they've never been tested for mono.
Now, that's contagious.
That is contagious. In fact, it's very common among school-aged
Right.
children.
To just keep passing it because they don't know what's going on.
Well, they come in and they know they've had a very sore throat, and they've assumed that it was strep or the local virus, and then they've been very fatigued afterwards and never really made the connection that the immune system is still recovering from the viral infection. Other more rare causes of ache and fatigue include things like heavy metal poisoning. We really don't see that as much anymore.
Right.
Polymyalgia rheumatica is an inflammatory condition seen in women usually over the age of 60. It is treatable with low-dose steroids, and it is testable on lab studies. Rheumatoid arthritis. Unfortunately, there are a group of people who have rheumatoid arthritis and fibromyalgia.
So
I don't see that they do
double.
have double whammy. I think anytime rheumatoid arthritis is widespread enough, it can give you widespread pain, and certainly a lot of the medications used to treat it can give you fatigue, so you have to be careful.
Okay.
Myasthenia gravis, not very common, but it is seen. Those patients tend to get worse at certain times of year. Multiple sclerosis is the same way. We've diagnosed a couple of patients in the clinic with multiple sclerosis.
Seasonal, it's more of a...
They're temperature dependent. Sometimes
okay.
in certain seasons they're better, in certain seasons they're worse. And then iatrogenic just means caused from drugs. Now, one class of drugs you have to be very careful about are the lipid controlling drugs like Lipitor,
the cholesterol,
Zocor, the cholesterol
drugs.
drugs. They can give, in a certain number of patients, severe muscle pain.
Oh.
And we have had patients who did better once their cholesterol medicine was switched.
Wow. So from the graphic, there are lots of things it could be.
Yes.
And, you know, there, of course, like you said, there are things that it absolutely is not.
Correct.
But then it should be critical that you come in when you have some of these you know, these problems. And we're going to get into the symptoms of it in the next segment and talk about that, because we're going to take a break here in about couple minutes. But it's very important that they come in and get tested.
That's correct. Right? I consider fibromyalgia a diagnosis of last resort, and that means you need to have ruled out all of those conditions, or at least considered them in your diagnosis before assigning the diagnosis of fibromyalgia to a patient, because that in itself has some repercussions.
And you are very careful with that. Apparently, you know, you want to rule it all out. And I know there are a lot of doctors that are like you that do that. But there may be doctors that, you know, they just say that's what it is and don't even go that far. So as a patient coming in with those widespread pain and the fatigue, you would suggest to them what? That they, to ask their physician.
I would suggest that they start with blood work, that they start with just simple blood work to look for anemia, vitamin deficiencies, thyroid function, to make sure the liver and the kidneys are working as they should. If you have a history consistent with heavy metal exposure, we do testing for that. I also, in most of my patients, will check laboratory studies for Lyme disease.
Okay. That's from ticks,
From
right?
ticks, especially if there's been any history of a tick bite. This area is prone to Lyme disease. I will ask them to have what we call Epstein-Barr titers. That's the virus that causes mono.
Okay.
And even after you've had the disorder, after you've cleared the virus, the acute infection, the antibodies hang around in your system, and we can still see if you've had a recent or remote infection for mono. So those are some of the main things that we do. Also, if there are any other conditions that do not fit the profile of fibromyalgia, we'll try to work those up as well.
Okay. Well, we have just about 1 minute, and I have a myth that I wanted to toss out there to you, because a friend of mine said that had an accident, was injured, and now I have all of these symptoms, the widespread pain. I ache all the time. I'm tender, and I think it came after I got hurt. Is that a myth, or is that a possibility?
Now, that is currently an argument in the literature. There are a group of people who feel like there is this possibility that you can develop post-traumatic fibromyalgia. Understanding where the research is leading us now about what the cause is, I don't necessarily feel that the trauma causes the fibromyalgia. There is some research being done now to suggest that people inherit the genetic possibility to develop fibromyalgia. In other words, it can run in families, and that stressful situations can either bring it on or aggravate the already existing condition.
Kind of like a flare-up.
Yes, correct.
Okay. All right. Well, we're going to take a short break, and then we're going to come back and we're going to go more in detail about the symptoms that you may be having some of those symptoms at home, and you may want to know if it's possible that you could have fibromyalgia. So we're going to go into that, and then we're going to talk more about the criteria again. So stay with us, and we'll be right back. Welcome back to Healthy Living. Our topic on this edition is fibromyalgia, and in case you're just joining us, I want to reintroduce my guest, Dr. Gay Richardson, who is a local physician who deals with rehabilitation and pain management, which is right where fibromyalgia hits, you know, just right in the middle. So we want to start again with the symptoms. What are the symptoms, the widespread symptoms? Again, that widespread thing you talked about.
Well, primarily, the one thing that's common to all patients is their widespread aching type pain.
Okay.
And when I say widespread, I mean it affects all 4 quadrants of the body.
Okay.
Again, the pain has been present for at least 3 months. But most patients have a myriad of other symptoms. In other words, pain is not their only symptom. Fatigue is very common.
Okay.
Problems with sleep is almost universal. And if you look at some of the more common books and papers about fibromyalgia, the sleep disorder is listed in the 90s. In my clinic, it's 100%. I've never met
everybody who has it has some kind of sleep disorder.
I've never met a true fibromyalgia patient who slept well without some treatment for that problem. But I see just as many people who have depression, anxiety, headache. Can be migraine type headache or even tension type chronic daily headache, irritable bowel syndrome. And what irritable bowel is, it means that your bowel does not work regularly. People a lot of times alternate between constipation and diarrhea even though they've had no change to their diet. Restless leg syndrome, that is a very common sleep disorder where people have trouble getting comfortable at night. They feel like their legs need to dance instead of relaxing at night. Depression, like I mentioned, sicca symptoms are just a group of symptoms, basically dry eyes, dry mouth, dry nose, that is often found with other rheumatologic conditions.
Okay.
And then Raynaud's phenomenon. Raynaud's is a condition where the blood vessels in the farthest reaches the body, basically the fingertips and the toes, don't respond to cold like they're supposed to. In other words, a person with Raynaud's can go out into cold weather and their blood vessels clamp down so tightly that their fingertips and their toes will turn blue. And that is a very painful condition where they need to keep their extremities warm pretty much at all times.
Okay. And then there's another, the graphic, migraine headaches, tension headaches. Can you?
Irritable bladder, chronic fatigue, all of those things are symptoms that can accompany fibromyalgia that I do not believe are independent diagnoses of their own. They go with the fibromyalgia. And weight gain is up there, but it can actually be fluctuations. I've had patients who also lost weight because of their pain.
Right.
Primary dysmenorrhea, that's a menstrual condition of irregular periods. We see that because of the hormonal fluctuations that people with fibro get. And then I want to touch just briefly on the cognitive deficits. There's a sort of catchphrase out there in the fibromyalgia population called fibro fog. I distinctly dislike this term because I don't really know what fibro fog means. My guess is that fibro fog is actually the difficulty with memory and word finding abilities a lot of us have when we don't get good quality deep sleep.
Okay, we mentioned at the break that there's a study out there because on my graphic it said like 100%. Sleep's very important.
Sleep is important for every human being. It is built into our circadian rhythm, our day-night rhythm, that we must rest in order to have normal hormone function, normal memory, normal anything. We need sleep, and that's just really there's no exception to that rule. In patients with fibromyalgia, again, sleep is almost universally disrupted. There was a nice study done in the 1970s by a gentleman named Dr. Moldovsky. He took, I believe, about 7 normal, healthy, perfectly functioning people in their 20s. He let them sleep in the lab every night for 7 nights, but right as they were getting to what we call deep stage or delta wave sleep, he woke them up and then would let them go back to sleep. And again, as soon as they got to that delta wave sleep, he'd wake them up. And after 7 days, every single normal, healthy volunteer reported aching, pain, tender points, and even some trigger points. Okay. So what we know is that when we don't get the good quality deep sleep that our body needs, that has repercussions in our muscles and in the way we interpret pain.
Well, let me ask you this. There's a lot of symptoms. Can you just have one and have fibromyalgia, or is it just you have to have several?
You don't have to have several. The
Okay.
American College of Rheumatology criteria in 1990 says it just has to be pain.
Just has to be pain.
Widespread pain.
And the four quadrants. If you only have it in the top left side,
that's not fibromyalgia. It needs
Okay.
to be widespread. It needs to be 11 of 18 tender points. Now, it doesn't have to be in all four quadrants, because if you look at a tender point map of the body, they are in all four quadrants, but they're concentrated some in the upper back, in the chest area, and so you can actually get 11 of 18 and maybe only have 3 quadrants covered, which is okay. That's still a widespread pain.
So what are some of those places that that if you're at home and you're having this widespread pain and this ache, what are some places that they might, if they maybe had fibromyalgia, that it would be those pain points?
Well, they are points I actually don't think of that are normally painful. So it would be on the elbows, in the muscle part of the elbow. There is one on the inside of the knee, the outside of the hips, and sort of the fleshy part. There are 4 spots, 2 each over some of the upper ribs. There are spots at the back of the skull, and then down the neck and shoulder area.
So there's 18 in those areas.
Yes.
And if you have 11 of those, when you do you can possibly be diagnosed with fibromyalgia and the widespread pain. All right, we've talked about the symptoms. Who gets it more often than not? Who's
the majority of patients are women aged 20 to 60. Okay. Some research studies list 75%. In my clinic, it's about 98% women.
98% women. Okay. And it said that about 6 million people have been diagnosed in the U.S. Here's our graphic in the United States. Something that I wanted to touch on, because we've mentioned this in the break. 6 million people is a lot of people.
Yes.
But there are people who have fibromyalgia and don't know they have it. Mm-hmm. And there are people who don't have it and think that they do.
Or have been diagnosed.
And
it's impossible to get a true feel for how many people in the country actually do have fibromyalgia. Number one, because of the difficulty we've had in physician education across specialties. In other words, are you really ruling out all those other mm-hmm. conditions that this could be before you give the diagnosis? And then there's a subset of patients who never go to the doctor, who assume, well, everybody has aches and pains. It's not that mm-hmm. big of a deal.
Some people can cope better.
Some people have amazing coping mechanisms.
Right.
And we can talk about that a little bit later, because I see the spectrum of from anywhere to where the fibromyalgia is sort of a nuisance. People understand it and deal with it, go on, work, live productive lives, all the way to the spectrum of people are disabled because they just cannot get a grip on the symptoms.
And some people may have many more symptoms than other people.
That's correct.
So it's harder to live with and to deal with. Let's go back to the criteria that you talked about in the study in 1990. And just hit that again. It's the 11 of 18 points and at least 3 months.
Yes.
You said. So if you're hurting out there and it needs to be 3 months. So when you go to your doctor, you need to know about how long.
Right. That's one of the first questions I'm going to ask you is, how long has this been going on? Mm-hmm. Did something happen? A lot of times I'm trying to pick out, did a person have a viral illness? Did they have an exposure to something? Is there some other element that contributed to their pain? Okay.
Have there been recent developments? You said in 1990 there was something that you said about hypothalamus.
Right. The current theory now is that fibromyalgia is due to a breakdown in what's called the hypothalamic pituitary system. In layman's terms, the thalamus is the master gland, meaning it is the gland in the brain that helps regulate all of our hormonal systems. And when you think about hormones, everybody thinks about, well, there's estrogen and there's testosterone. Right. And that is the tip of the iceberg. Our entire bodies are controlled by hormonal systems, things we don't even think about. Serotonin, norepinephrine, and dopamine, the 3 primary hormones in the brain that determine our mood, that contribute to our sleep. Glucagon and insulin are our 2 hormones that regulate our blood sugar.
Right.
Thyroid is a hormone. All of our endocrine systems are hormonal systems, and therefore, if you think about it in those terms, you start to see how many of these other symptoms can develop, why sleep is disrupted, why fatigue is a problem, while you can have bowel and bladder symptoms, because the bowel is a serotonin-driven system. So if you understand that physiology, you understand how all these other things can be breaking down and not working at the same time.
How do you... Oh, there was one more that you said, a more recent one.
There is a more recent theory, and this one has not been tried and tested as of yet. There is a theory that I have read about multiviral exposure. Now, all of us, since the time we're children, get exposed to viruses. Our generation has been exposed to the chickenpox virus, and we all get common colds and flu and all kinds of things. The theory that I have read says that it's not being exposed to one virus or another. It is the cumulative exposure to these different viruses over time that becomes such an insult to the immune system that the immune system has trouble regulating itself. And here we are back to the thalamus again.
Right.
So, you know, these are some things that are still in development. They have not been well proven yet. I will tell you there's at least 100 studies a year coming out on fibromyalgia and on the different hormone systems, and the fact that we're now starting to be able to prove that hormone levels are different in people with fibromyalgia than in normal controls.
So there's hope.
There is hope.
There's hope for people who are having these problems.
Yes, there is.
That there are people out there trying to figure out what's going on.
Yes. But what that brings you to, though, is a warning.
Okay.
You know, there are a lot of products in the media right now, and it just breaks my heart. I see patients come in with bags of vitamins, bags of herbal supplements, and they've spent $200 or $300 or $400 on these supplements because somebody said this is a fibromyalgia cure. There is no such thing. And it's not because anybody's trying to hide it, or it's not because, you know, we don't want you to know that there's an herbal. It has nothing to do with that. It's about the fact that we don't know yet. When there is a cure, it'll have to be researched. There will be medications hopefully developed for that, or treatment methods. But right now, if you see vitamins, herbs, supplements, things online or in the stores that say fibromyalgia cure, my suggestion is turn around and leave, because those are money-making gimmicks. But people are susceptible when they're in pain.
Because they hurt and they want something.
And they want relief, and I can't blame them for that, but be careful about parting with your money.
Well, what treatments are available from your perspective that we have?
The only proven treatments are treatments of symptoms. And so that's why it's so important for us to go over that symptom list.
Okay.
There are treatments available for irritable bowel. There are good treatments. There are several medications now on the market. You've probably seen the commercials with the butterfly on TV for sleep disorder. There are good treatments for pain. But what we can get into later, one of the best treatments is exercise therapy.
Exercise, and we have a picture up here about the normal control and the fibromyalgia. Is this the hypothalamus?
This is a PET scan. This is some of the research.
What's a PET scan?
It is a positron emission scan of the brain, which shows what areas are active in the brain according to blood flow. This is actually a very nice study where they took normal, and I don't like the word normal. Let's just say non-fibromyalgia patients versus fibromyalgia patients, and they did a stimulation, basically generating pressure on the thumb. And what they showed in this very elegant study was that in the pain centers of the brain, fibromyalgia patients lit up at a much lower threshold of thumb pressure than did control patients, meaning that their pain systems are very hyperactive. They're very sort of on the alert, if you will. And so that was one of the first diagnostic studies where we actually saw a difference.
Well, number one on there is exercise. Why is that so important?
Because most patients' response to pain is to decrease activity. And that's, in a way, that's sort of what we think we're supposed to do. And in fibromyalgia, that's very counterintuitive. You know, normally if let's say you raked leaves in your yard all day on Saturday and you were sore the next day, you would probably not go out and do that again. You would rest and try to give your body time to recuperate. In the patient with fibromyalgia, that pain signal stays on all the time. And so some people think that if they can avoid the activities that give them pain, that they'll be better. What actually ends up happening is they become very deconditioned, they lose muscle mass and muscle tone, and the pain actually gets worse.
So it's a catch-22.
It is a catch-22. And it's the hardest one I have convincing people of.
Of course.
Because they say, it hurts for me to walk. And I say, yep, it's going to hurt. And it's going to
but
get better.
But it's pain here or pain here?
But it's going to get better.
Okay. Well, we have a fibromyalgia patient here. She's going to come and talk to us. And you'll stay on with us and talk more about fibromyalgia. So stay with us and we'll be back with a fibromyalgia patient. We'll be right back. Welcome back. This edition of Healthy Living, we're talking about fibromyalgia. And in this segment, I have a patient who has been diagnosed with fibromyalgia, who also happens to be my mother-in-law, Kathryn Thompson. Thanks for being here, Meme.
You're welcome.
That's what I'm going to call her for the whole show, so I might as well just start out doing that anyway. We want to just start out talking about what happened in your life that you thought something's wrong, something's going on, and I need to figure out what's wrong with me. What kind of symptoms did you have?
I was probably 16 when I developed headaches, irritable bowel syndrome, and just kind of felt achy, but I didn't know the difference that I thought everyone felt like that. And after I had children, it seemed to just be getting worse, and the achiness spread from my stomach, my head, to mostly my lower back. And I was fortunate to have a doctor from the time I was 18 until he retired several years ago. And so he saw the progression of me, the aches, the pain, the fatigue, the sleeplessness, but it's probably about 24. And I think I went to an orthopedic surgeon first, thinking that something was wrong with my legs because my legs had restless syndrome, and the achiness in my legs and back. And there was a lot of different things that showed up in my blood work, which lupus wasn't widespread diagnosed at that time, and I was sent to Nashville to a rheumatologist when I was 34. And they did a lot of workup that Dr. Richardson was talking about early to just say that I wasn't diagnosed with any of the other. And I actually was first diagnosed with ankylosing spondylitis, which is an autoimmune system disease. And
we didn't talk about that. Why not?
Well, it is autoimmune system disease, rheumatoid arthritis, which is not fibromyalgia, but it wasn't long before I was diagnosed with fibromyalgia. I have 18 of the tender points. I'm one of those patients who are in a flare-up almost all the time. I do not like to talk about my pain. I try to manage it the best I can, because some days I am bedridden and sometimes I can get up and get about. I have had a lot of difficulty, but the rheumatologist in Nashville wanted to do a study on my family, because I have 9 brothers and sisters. Half of those were diagnosed with fibromyalgia, and they do get treatment now. I have 4 children, and 3 of them actually have been diagnosed with fibromyalgia.
Mine's the only one who hasn't been diagnosed yet. So you've had trouble for years and just didn't know what it was and didn't have a name to it. We talked about that, Dr. Richardson. They just didn't know what to call it. So they called it the other stuff that they knew, the rheumatoid arthritis.
And one point to make too is the fact that just like you said, ankylosing spondylitis is a separate condition. It is in the rheumatologic family of conditions characterized by having an abnormal gene, HLA-B27.
Correct.
I believe, and that again is a treatable condition that needs to be taken seriously because it is treated very differently than we treat the symptoms of fibromyalgia.
So tell me, you didn't know what it was. Didn't know exactly.
Actually,
well,
yeah.
I mean, they were telling you all these other things. First, it was, you know, maybe it was lupus, maybe it was rheumatoid arthritis, maybe
Chronic
it was
fatigue syndrome.
Chronic fatigue syndrome, and you hear
Right.
that all the time.
And even at that time, if they know what they're dealing with, everybody was calling it by so many different names
Exactly.
that you might have said, well, I have fibrositis and chronic fatigue and I'm chemical sensitive, and you have all these things, and we're actually talking about the same disorder.
What does that mean? Yeah, what does that mean?
Well,
Yeah.
that means that, you know,
Right.
what happened in 1990 needed to happen. There needed to be an
Exactly.
agreement on what are we dealing with, because until we agree on the condition and how you define it, you can't do valid research. So really, until in 1990, when the College of Rheumatology gave us some guidelines, all of the research done prior to that was probably not of the best quality, because the patients were called so many different things and may have actually had different conditions.
Right. So when all this is going on, you don't really know. How does it make you feel psychologically that you know something's wrong, and each time they tell you it's this, well then that treatment doesn't work and this doesn't work. How does that make you feel when you just can't put your finger on it, and you can't you can't explain to somebody how bad you hurt?
And it was about 1985. I was still working with the 4 children at home, and I am a worker, and as we spoke earlier during break, I'm a 6-hour sleeper, and that is with medication. I remember going to work the last 3 months that I was going to work. I could hardly lift one leg to the gas pedal, to the brake, for the hips. And I was so fatigued that sometimes I don't remember getting to work. And I would work all day. Finally, you know, the doctor said, you cannot stand up, you've got to have some rest, you're just wearing yourself out. And I gave up working. I knew nothing about any medical conditions at all. And my doctor in Nashville, the rheumatologist, started me on some books that he had in his library that I could study, and I've studied ever since.
But not everyone's like you. Not everyone is going to study and figure out, well, it could be this, it could be this, you know, all these things, and go to their doctor and say, okay, I have this, 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 and this. Now tell me what that means. Because we did in the other segment, there's lots and lots of symptoms that could be fibromyalgia. But what I really want you to say is, how do you know, I have also, I talked in the first segment, a bladder disease, that you cannot explain to someone how you hurt. And you can't get that through to someone. And when you hurt in 18 tender points, and explain to me how you live with that? How do you live with it every day? And explain to the type of pain and what it's like.
On a mild day, I have pain every day.
Okay, every day you have some type of pain.
Every day I have pain. I do not like taking pain medication. Recently I was taken off the Celebrex, Vioxx, whatever that I was taking at that time, also the Lipitor that Dr. Richardson was talking about earlier, because of some incidents I've been having in my life, at nighttime it is hard for me to go to sleep, even with pain, even with sleeping medication.
Because you hurt so badly?
I suppose that's what it is. This started in 1986, where I can't go to sleep. Then when I do go to sleep, I might sleep a couple hours, I'm awake, go back to sleep a couple hours, I'm awake. And sometimes it would be very fortunate that if I got to sleep 4 hours at a time. When I get up in the morning, my feet hurt when I put them on the floor. I do have the tender points in this, but not all the time in my arm. It's probably my least likely place to hurt is in the elbow. My worst place is in my neck and in my shoulder and in my head with headaches. and in my lower back and the outside of my hips.
Is
These are points that hurt continuously all the time. I take Tylenol for pain, and that doesn't help very much, but I'm just working on it.
In clinic, we call it "please don't touch me" pain, because these patients will often describe that if they go to church, they don't want to shake hands, they don't want to hug family members, they don't want to sleep under a heavy quilt or bedspread,
Really?
because the actual touch of the material, you know, just
even on the skin.
Even on the skin is very painful. And we have a medical word for that type of pain. It's called allodynia. It means a normally non-painful touch is painful to that person. And that's one of the hallmarks of fibromyalgia pain, is allodynia.
Does that happen to you?
Mm-hmm. And another thing I haven't heard Dr. Richardson talk about it, and is like the hearing, and how noises also hurt my ears. If there's a lot of loud noise, like loud music in the church, or loud noises, or a lot of people that are talking, it's not really distracting to me. It's not the fibroma fog that you were talking about. Just loud noises hurt my ears.
If you think about pain in general, and this is not just fibromyalgia, this is true of any chronic pain situation, the body is not used to having pain on a daily basis. And what that creates is a very high stress situation in the body.
Okay.
It triggers off our fight or flight response, basically. Okay. But if you live like that on a chronic basis, even simple stimulus, just loud noises, lots of people around you talking, the more stressed out we are, the more difficult stress is to deal with. And that's how I explain those kind of symptoms, not necessarily as on an endocrine basis like fibromyalgia, but on a fact that the body is so revved up, it just doesn't have, basically you're at the end of your rope and you don't have anything left.
Right, and so the stress, does stress affect you that way, make you hurt worse?
Well, you probably know this, because sometimes, you know, Tammy may come in and I just start crying. And what are you crying for? And, you know, I'm just crying because I'm hurting and don't know what to do with it, so I just cry a little while. And
so do you have, does it affect you mentally, depression, anxiety?
Yes, that is one of the medications that I don't want to go off of, is the antidepressant. I do take antidepressant pills, and I have for probably 25 years.
And it's just, if you do not have chronic pain, you just cannot explain to someone what that is like. And so this is just, I'm going to play devil's advocate here, that people will say to you, you know, you take all this medicine, it's all in your head. It's not real. You know, you can't see it. You can't, you know, it's all in your head. I mean, what do you tell people like that?
Most of my friends and most of my family have seen me in a lot of pain where, you know, I may just be laying there, I'm real pale, my eyes are usually different, I just can't get around. If I'm sitting down and I'm not going, they know that I'm sick. You just got to keep going. If it's the mild pain, like Dr. Richardson said that some people have, I do have a high tolerance of pain. If it's mild pain, I keep going. And if it's hurting so bad I know that I can't walk on my feet, it's time to sit down.
So you just have to know your own body and know what you can do. And you have to take it. How would you respond first to that question about it's all in your head?
Well, my advice to patients when I've done lectures about this topic is that if you walk into the clinic and the doctor tells you it's all in your head, that you get up and you walk out and you find another opinion about that.
Exactly.
You know, one of the coping strategies is surrounding yourself with people who not necessarily understand, but take you seriously when you tell them that you're having a problem. I tell all of my patients, unfortunately with this disorder, you look fine. It would be so much easier if you were missing an arm or a leg, or you had something on you that said, I have pain.
Right.
Because we as human beings look at each other, and if everything looks pretty well collected, we make the assumption that you're fine, that you're having a good day, and that everything is okay, and that's really a false assumption. The other thing you have to remember about pain is that nobody can understand anyone's pain, because pain is a unique human experience, and that's even part of the definition of today's pain societies, is that pain is unique to every human being because our brain chemistry is all a little different. So we experience pain differently. How we deal with that, though, is also unique, and that's where we can make some gains, that's where we can make some treatment in teaching people to deal with their pain, to cope with their pain, and mechanisms and strategies to help them go on with life.
Okay, well, we're going to take a short break, and then we'll come back and talk some more with you, Kathryn, and you, Dr. Richardson, about some of those strategies and how if you use some of those strategies to deal with your fibromyalgia. Stay with us. We'll be right back. Welcome back to Healthy Living. Our topic, fibromyalgia, and I have with me Dr. Gay Richardson, who is a physician dealing with rehabilitation and pain management, and Kathryn Thompson, one of my favorite people, my mother-in-law, who deals with fibromyalgia and was diagnosed with it. We're going to jump right into talking about the ways that you can treat it again, because we've hit all the areas. Let's hit again some of the treatments that you recommend if you've been diagnosed with it.
Well, basically, treat the symptoms. That's the rule today. And the number one thing that has to be corrected before you'll make any gains in any other area is sleep. And so you believe in sleep? I believe in sleep. I'm a firm believer in sleep. Okay. And so before I will discuss exercise therapy, before I will discuss any physical therapy or even medications for pain control, I discuss what's the sleep problem. Are you having trouble getting to sleep, staying to sleep, or both? And, you know, all the other things that go with that. Is there sleep apnea? Are there restless leg symptoms? You know, until we get that sleep corrected, my feeling, and it's one of my rules for treating fibromyalgia, is no sleep, no heal. So that's the starting point. Okay. And then exercise. Exercise is probably the number one treatment. And getting people to buy into that is sometimes very difficult, because if you've been hurting for a year or 2 years, or in some cases I see people have been hurting for 10 or 20 years, and then I say, well, you need to start exercising, and they look at me and go, yeah, right. But the problem is we are so used to what I consider the American College of Sports Medicine recommendations for exercise, which says you need to do 30 minutes at 60% of your target heart rate most days of the week, that people look at that and go, there's no way. So we have to actually take a step back, and I tell patients, okay, figure out something you like to do. And this is one of those cases where traditional exercise may not be the best thing. Okay. For some people, Tai Chi, gentle yoga. There's actually a wonderful book by the American College of, the American Arthritis Foundation that shows the very most basic of yoga moves to help people stay flexible. So whether it's walking, or the elliptical bike, or walking in the water, which is wonderful for patients with fibromyalgia because there's no risk. I mean, if you fall down, you float, basically. And this water helps with the stress of the joints. Helps with the stress of the joints, and it is a resistance medium. So whatever it is that they like to do, I say start 10 minutes a day. Start there, 10 minutes every day. Judge how much you can do by how sore you are the next day. And in fibro, what's different about fibromyalgia is that the exercise does need to be a daily component. It needs to be something you work your body back into on a regular basis. Now, when they get to the point where they're doing 25 and 30 minutes of activity every day, we start to normalize the exercise. We start to say, okay, 3 to 5 days a week is probably enough. Some people can do that. Some people can't, though. And some people, it takes 6 months or a year for them to work back into that. But once they do, other things start to happen than just the deconditioning improving. You actually get some normalization of the endocrine problems. I think hormone levels start to level off. People have less depression. They have less problem with reactive hypoglycemia, which is not something we've really talked about, but again feeds into that insulin being a hormone system. They start to have better regulation of sleep. And all of that is started by getting your body back to movement.
So the two things you've mentioned, well, the sleep may need medication, but the two things you've mentioned, sleep and exercise, are critical to people who have, they're critical anyway, but to people with fibromyalgia, it's very, very important that you do those things. But she talked about the catch-22. She talked about you exercise, you hurt, you don't want to exercise. How do you deal with that?
You do it anyway.
Now, I know you garden a lot.
I garden.
So does that count?
It does count.
Okay.
I don't count that as exercising. Every day, well, 5 days a week at least, I do stretching exercises. That seems to be more important to me, of stretching my neck, my back, my legs, my arm. I do the stretching exercise. I love to garden. I can't bend down. I may be sitting down and moving my arms or whatever, but I stay active that way. For the last 2 years, I've been doing exercise programs, can I say who with? Curves, and that has been the only exercise that I can do. It's because it's not repetitive. It's walk a little bit on this, and then you lift or you move your arms. So when you do some walking and then work with your arms, then work with your back, it seems to do better. That's the only thing that hasn't ever hurt me. It hurts while you're doing it. It hurts more the next day, but I've done that 3 days a week for the past 2 or 3 years, except for time I've had to take off for being sick and my daughter being sick.
If I could get every patient to do this,
it is
we'd
hard
have a lot less problems.
It is hard to do. I hate exercise.
Me too.
Been, you know, like 20, 25 years trying to get to this point that I could do it for the last 2 years. But what I would like to say too, the exercise is a great thing. Doctors always tell you, you got to exercise. I don't care what it's for, you got to exercise. I do believe that the exercise brings out endorphins, or
yes,
that helps you
absolutely
with your pain. It has not helped me with any sleep or any, I can't really tell any difference, but I'm not going to stop doing it because it might be worse. I truly believe in massage therapy. I have done that once a month for the last 5, 6, 7 years. And
does your insurance pay for that?
My insurance does not pay for that, but I won't give it up. I don't get manicures. I don't eat out lunch very much. That is my one thing that I like to do. I have the same massage therapist, which if people do want to go to a massage therapist, I recommend that they go to 3 and pick out the one that does the best for them. Because if you haven't ever had massages, you don't know what is the best for you.
You have to be careful, because a lot of sort of traditionally trained massage therapists are trained to do what we do call deep tissue work or myofascial release, and that's more for myofascial pain. And if a fibromyalgia patient gets that done, it can be very painful for many days or weeks afterwards. It's too aggressive of a massage technique. So you have to have a massage therapist who understands fibromyalgia, does more of
even to the touch sometimes.
Yes.
Sometimes. So deep tissue is going to...
The thing you have to realize too is that massage therapy is another endorphin releasing treatment. That just the touching of the skin has been shown to promote hormonal balance, pain control, relaxation, lessening of stress, and all of these things can help bring a person down from a flare.
Okay.
I mean, I'm a big believer in massage therapy as well, even if your insurance won't pay for it, because it's well worth the investment.
So we talked about everything that I think I wanted to cover, but I wanted to talk, you talked about that you have seen patients who've hurt for a year or 2 years, but you've had patients that have hurt for 10 and 20 years. Now, something you said in the break, time is of the essence. Can you explain what that means as far as fibromyalgia?
And it's not just fibromyalgia. It's in any kind of muscle or pain condition. Time is critical. The faster I can get to a patient, the faster I can get a patient's pain controlled, the better off that patient is going to be. The problem with our chemistry, our brain and spinal cord physiology, is that when we suffer from chronic pain, there are actually changes that occur at the level of the cell, at the level of the very neuron in the brain, that change how we forevermore interpret pain. And that can set you up for a lifelong problem if you don't get that cycle interrupted. Pain is a feedback system. The more you hurt, the more symptoms you have. And a lot of times those symptoms drive each other. The more you hurt, the less you move. The less you move, the more you hurt. You see where I'm going with that?
Right. And it's the coping mechanism. Some people can cope more than others, so they may go longer without seeking treatment than others. Some just are stubborn and say, I'm going to go and I'm going to keep moving forward, and it doesn't matter. And you just have to know, you have to interrupt that cycle, like you said.
But the problem with that type of patient, the problem of the patient who just goes and goes and goes, is that they lose their coping mechanisms along the way. And what I see in a lot of those chronically ill patients is they have given so much of themselves to everybody else, to the family, to the job, to the parent they're caring for, and ignoring their own problems for so long that by the time I get to them, I get what's left over. And sometimes there's not a whole lot to work with because that person is so depressed and so sleep deprived and in such pain that we then have to say, okay, we need to separate you from all these other responsibilities that you've put first and now teach you how to take care of your own health before there's nothing left. Yeah.
Good luck, because that's what's hard, because you have those people that are just, everybody else is more important.
Right. And everybody relies on them.
That's right.
Or at least that's what they perceive.
And if you don't take care of yourself, then there's nobody to take care of all those people when it's over. So we're just, real quickly, we have a couple of minutes. The planned approach, Dr. Richardson, if you can just go over that, how you came up with that.
Well, these are my rules. Number one, the first thing is to confirm the diagnosis, and that's to go through all the laboratory studies, make sure we're not dealing with a thyroid problem. Make sure we're not dealing with a patient who's anemic, because I can really significantly improve those conditions, and some of them can be fixed, not all of them. Next, and these are just my rules, these are not published anywhere. Number one is the exercise, move it or lose it. No sleep, no heal, and the most important thing, especially in certain situations, is not everything is fibromyalgia. And what this brings to mind is one of my very favorite patients. She's been with me since I really started practicing here in Paducah, who came to me with a diagnosis of fibromyalgia that we later confirmed, but came in one day saying that she was having chest pain. And she had been to see her regular doctor, who had told her that was probably just her fibromyalgia. And I said, no, chest pain is not fibromyalgia. I want you to go back and have that re-examined. And she did, and a week later had a stent placed because of coronary artery disease. And you have to be very careful. Sometimes, as physicians treating chronic pain or seeing chronic pain, and this does occur in the emergency room as well, we become sort of blunted to the patient who is labeled a chronic complainer. Or some patients who take pain medications on a daily basis, we think, oh, that's just, you have pain every day, of course you hurt. Well, you have to be careful, because even patients with chronic pain can have appendicitis, kidney stones, heart problems. They can have other general medical things that can be an emergency if it's not treated. And so I always tell my patients, if you're having chest pain, that's not fibromyalgia. If you're passing blood in your urine, that is not fibromyalgia. And they need to be insistent about those things, that those be evaluated.
Well, I appreciate both of you coming, and just like that, you know, you have to deal with your life every day with this disease, and I hope that we've helped some of you out there to possibly go and seek some medical advice to see if you possibly may have fibromyalgia, and if you've already been diagnosed, to help you, and maybe some of the treatments and some of the information we've given you can help you improve your life. Dealing with that every day. We have the websites that you've been seeing throughout the program that you can go there and find out more information if we've missed anything and you want more information. Just get help, seek help, and don't hurt for no reason. Try to get a diagnosis and live your life the best that you can. Thank you so much for joining us. I really appreciate both of you coming. Thanks for joining us. We'll see you next time on Healthy Living.